you. Welcome to Dr. Vibes. In this video, we will study the pathophysiology of shock. In this video, we will study about the pathophysiology of shock. Let us consider what is happening in a cellular level. Shock matlab kya? एक ऐसा condition when there is hypoperfusion of the tissues. So there is hypoxia in the body. This hypoxia will cause the tissues to go for anaerobic metabolism instead of aerobic metabolism. Anaerobic metabolism will produce more of lactic acid, so lactic acidosis in the body. This lactic acid will destroy the cell membrane, so cell membrane damage. In the cell membrane, there are the sodium, potassium, ATPase pumps. So if the membrane is damaged, these pumps will function in a wrong way. So dysfunction of the Na plus K plus ATPase pump. So what will happen? What does Na plus K plus ATPase pump do? They throw Na plus out of the cell, K plus into the cell. So if this is not functioning, what will happen? Na and calcium will increase inside the cell and there will be K plus efflux from the cell. Correct? As a result of this, the lysozymes, which are the cellular organelles, will get activated and they will break down and release certain enzymes. These enzymes are actually powerful mediators. This entire process is called as a sick cell syndrome because lysosomes are breaking down and they are releasing powerful mediators. Now, platelets will become activated and these platelets will form small clots. So, clots form ho gaya hai. Body will try to compensate this clot formation by consumptive coagulopathy, which is called as disseminated intravascular coagulation or DIC. Now this further aggravates the bleed because DIC is not a good condition in the body. इसकी वजह से और bleeding होती है. Now let us study what are the systemic changes. अभी तक we have studied the cellular changes. Now we'll study the systemic changes of shock. So consider there is any cause of shock in our body. क्या होगा? Shock से क्या होता है? Cardiac output कमेगा, right? Because टिश्यूज को जितना ऑक्सीजन चाहिए उतना नहीं मिल पा रहा है तो कार्डियक आउटपुट अल्टीमेटली कम गया. आफ्टर दिस कार्डियक आउटपुट इज डिक्रीज देयर विल बी सिंपैथेटिक एक्टिवेशन इन द बॉडी. देयर विल बी राइज ऑफ द सिंपैथेटिक ड्राइव. एज अ रिजल्ट ऑफ सिंपैथेटिक ड्राइव वी ऑल नो दैट देयर इज vasoconstriction बिकॉज दिस इज अ कंपेंसेशन मैकेनिज्म ऑफ द बॉडी कि वाइटल ऑर्गन्स को अगर ऑक्सीजन नहीं मिल रहा है तो वाइटल ऑर्गन्स को ऑक्सीजन देना होगा और पेरिफेरी जहां पे ऑक्सीजन जा रहा है वहां पे कम कर देना होगा. तो वेजो कंस्ट्रिक्ट करो, पेरिफेरी पे कम ब्लड दो और वाइटल ऑर्गन्स को ज्यादा ब्लड दो. सो दिस सिंपैथेटिक ड्राइव विल कॉज मोर ब्लड टू द वाइटल ऑर्गन्स लाइक लिवर, हार्ट, kidneys and less blood to the peripheries, that is the skin. Now, one more thing that can happen if the cardiac output is decreased in your body, there will be activation of the RAS system because अगर किडनी में भी कम ब्लड जा रहा है, this renal hypoperfusion will cause the RAS system to get activated. Now, RAS system also causes vasoconstriction and it also releases aldosterone. Aldosterone will try to retain sodium and water in the body and that will cause a decrease in urine output. क्योंकि water retention हो रहा है तो urine output कम हो जाएगा. Now, if the shock persists for a long period of time, it will cause decrease in cardiac output. इससे hypotension होगा, tachycardia होगा, poor coronary perfusion होगा, right? As a result of the poor coronary perfusion, there will be poor cerebral perfusion क्योंकि blood ठीक से brain में नहीं जाएगा. As a result of this, there will be decrease to the sympathetic tone, and decrease in the sympathetic tone will causes loss of compensatory mechanism, and that will lead to refractory shock, and the person will never be able to come out from it because the body has also given up. No compensatory mechanism is working in the body. This is all about the pathophysiology of shock.